Pure West Radio. It's your station for Pembrokeshire and indeed from Pembrokeshire. And all this week we are supporting Dementia Action Week. I had Cherry on the show on Monday, and this week is all about awareness. It's about talking, supporting, and just generally getting you talking about dementia, as it really does affect so many lives right here in our county. And joining me here on the show this morning, I have the lovely Charlie Duhigg, who is joining us from the Admiral Nurses, and also Jennifer Hill as well from the Welsh Choirs. So a very good morning to you. Thanks ever so much for joining us on the show, girls. Much appreciated.
Thanks for having us.
Yeah,
absolute pleasure. Lovely to have you with us this morning, ladies. So Charlie, first up, tell us about the Admiral Nurses. What's that all about?
So we are a group of specialist dementia nurses who work all over the health board, and we support carers and families of people living with dementia who are experiencing kind of complex difficulties, and we will kind of help them to look at strategies, education, linking them in with other services. So we work really closely with Cherry and lots of the other services, but particularly for carers and families.
As I mentioned with Cherry on Monday, dementia is one of those things that until it hits you and affects you, you don't really know what support's out there. Of course, with the Admiral Nurses, you're living it and breathing it every day. And what a wonderful job that you do. But it's a service that is there that you never know when it's going to be called upon.
Yeah, it can be. And we've got lots of links with the Alzheimer's Society, like I say, with Cherry and PAVS. So really it's about kind of working together. So people are picked up at whatever stage of their journey that they're at, that they're getting the right support at the right time.
And in what sort of settings do Admiral Nurses sort of go about their work? And is it in hospitals, home care settings, at the home? What's a typical day in the shoes of an Admiral Nurse?
So Admiral Nurses across the UK work in a range of different settings. So like you say, it could be hospitals, could be hospice, could be sitting within social services, memory clinics. In Pembrokeshire and Hywel Dda, we work in the community. So we link in very closely with primary care, with the GPs and those kind of services. And most of our work is community settings. So we're out visiting people in their homes, or perhaps in a community setting in a group, to kind of support those carers.
And how many Admiral Nurses are currently in Pembrokeshire at the moment then, Charlie?
In Pembrokeshire, we are just waiting for a job advert. So at the moment, there is one and me, and soon, hopefully, there will be two. So there will be, when we're up to kind of full capacity, there'll be two in Pembrokeshire, and there's 7 of us across the health board. So one of the biggest services in the UK, I think, at the moment.
Brilliant. I mean, it's so reassuring. I mean, I've personally been affected by dementia, as so many people have, and you never know when it may come into your life, whether it be a close friend, a family member. Just having that reassurance that there are specialist nurses, it really does just give a peace of mind to so many people.
Yeah. And it's, dementia is everybody's business. It's really important for everybody to be aware, so that we all provide, different levels of support. But as long as everyone, like you say, is more aware of dementia and how to support someone, it just makes it better for everybody.
And a sterling job that you all do. Jennifer, thank you for joining us here this morning. You're from the National Operatic Society, Welsh National Opera, absolutely fabulous. And you're involved with the Cradle Choir, which we've heard a great deal about here at Pure West. We're always letting our listeners and followers know about the events that you're doing in Pembrokeshire. Thanks for being with us, and tell us about your role within the opera.
Yeah, so I'm within the Programmes and Engagement Department at Welsh National Opera, so we do a lot of work with communities, schools, all sorts of different groups. And so the Cradle project came about a couple of years ago. Like everybody here probably, my mother had dementia, and it sort of occurred to me afterwards that you learn such a lot when you experience that firsthand, but actually there's so many little bits of information that would have helped us sort of have a better interaction with the person who's really close to us, the person we really loved, and I was thinking about this and actually got to thinking, well, actually, it would be lovely to do work with primary schools and to just very gently introduce that topic and then do some creative work around it. So we've been running this program for a few years. It got cut short with COVID, unfortunately, but it's got 2 parts to it. So we've been working with Milford Haven Community Primary for a couple of years. So all of the year 5. So we're talking about nearly 100 school children, year 5s. And they would have dementia awareness sessions with Cherry, all done in a very sort of age appropriate way. And then the children go on and write lyrics and music for songs sort of related to the dementia experience. So nothing too scary, if you like. It might be that they write a lullaby that they would like to sing to people living with dementia, or there can be fun songs around the topsy-turvy, which you can obviously is quite a clear link with what happens with somebody living with dementia and things becoming quite confused. So the children create these songs, they have a really fun time with our composer, and then they come together at the end of the year and sing these, and they'll be singing these at the Torch Theatre on the 11th of July. So that's one really important part of the project, which is just gently introducing that topic to children, just so that they can better sort of interact with people and have that sort of bit of extra knowledge, a bit of fear factor taken away. A really crucial part has been over the last few years that the children get to meet someone who's actually got dementia. That's been a little bit more tricky this last year, but previously that was working really well. And it's getting a bit easier again to do that. But as you can imagine, working at schools and working in care homes has been tricky for everybody. But then the other really big part, which you probably heard about, is the Cradle Choir. So this is a fantastic group of singers, people living with dementia, their supporters, who come together every Monday at the Torch Theatre. They have a lot of fun. There's a lot of laughing. They sing a range of popular songs. It might be folk songs. They do sort of vocal warm-up exercises, tongue twisters, things to get the brain going a little bit. But it's just generally a lot of laughing and a lot of music in there. And I think we all know the sort of the benefit of community, doing things in the community, and just the sort of supercharging it with singing as well.
And there's nothing like socializing, singing, and just getting out there. It just does the most wonderful things, doesn't it?
Yeah, I mean, we see that, people coming in, they might look a little bit downbeat, but by the end they're sort of bouncing out of the room, and there's a new community of people who are having that similar experience. And although it's designed for people living with dementia, sort of dementia is left at the door, if you like. We don't talk about that. We're just having a lovely time together.
Yeah, and a wonderful distraction, I'm sure that is, and just bring like-minded people together. It does have the most wonderful results. Thank you for sharing that with us, Jennifer, and keep up the wonderful work. And please keep telling us about all of the great events that you're doing. I know the Cradle Choir meets at the Torch every week, but please do keep sending us the information through. Charlie, as well, thank you ever so much for being with us here this morning and sharing us just a little snippet of what it's like to be an Admiral Nurse. And we admire the work that you all do in the community. If anyone would like any more information about the work that you do, Charlie, and if someone's listening thinking, oh crikey, I know an Admiral Nurse would be a godsend for my mum, dad, brother or sister, how can people reach out and get in touch?
So the best way is to go to a health or social care professional, or if you're involved in the Alzheimer's Society, it might be that you link in with Cherry. But if you go to whether it's GP, social worker, and say, I think I need the support of an Admiral Nurse, and they'll be able to refer you to us. There's also some information available on the Dementia UK website, which is an organisation that we're partnered with. So there's lots of information, leaflets. They do an Admiral Nurse helpline. So even if you're not known to the local service, you can phone that number. It's open 7 days a week and get support through that as well.
Wonderful. Thank you, Charlie. And Jennifer, if anyone would like to pop along to one of your events or join your quest to spread more cheer and just wondrous joy throughout the Dementia Society we have here in Pembrokeshire through the power of singing, how can they reach out to you?
Well, they can certainly just contact me at Welsh National Opera. Or alternatively, if they fancy coming along to Cradle Choir, it's open access. We're not going to make anybody pay or sing or do anything terrifying. They can just turn up at the Torch on a Monday morning at 10:30, and we'd be very, very pleased to see them. We've got some fabulous volunteers who are always there. I pop up every few weeks, and literally just come and join us, try it out, see if it's for you, and go from there, really.
Sounds fabulous. Thank you to you both for joining us here on Pure West Radio this morning, a part of Dementia Action Week. Please join us and our quest to spread the word of dementia. And just to let you know that the support is there. Thank you, Charlie and Jennifer.
Thank you.